So we are officially starting this webinar organized by the ISFTH, International Society for Telemedicine and Health. I welcome on behalf of the ISFTH to all of you. So I hope you can hear me. My name is Adolfo Sparenberg. I'm a member of the board of the ISFTH. So we should start right now. Dear colleague and board member of the ISFTH, Dr. Michelle Griffith, dear invited speaker, Dr. Dina Ziadlo, ISFTH affiliated members, colleagues, and partners. On behalf of the ISFTH, I welcome all of you to this webinar that is organized by the Medical and Bioinformatics Working Group in conjunction with the ISFTH Executive Secretariat. So today, the very special theme of this webinar will be digital health leadership in healthcare organizations, a session that will be moderated by Dr. Michelle Griffith, a member of the ISFTH board. So our very special and distinguished guest and speaker will be Dr. Dina Ziadlo. Once again, I ask you, can you hear me? Is that okay for you, the audio?
Yes.
Yes.
Okay, thank you. So at this moment, I would like to inform that the webinar transmitted via this platform, any meeting, will be recorded. So the content of slideshow and respective audio will be available to those colleagues that for whatever reason couldn't attend the live session today. So the access link to the recorded session will be informed in around 24 hours, and that will be posted on the ISFTH website. During this session, a chat box will be available on the left side of the screen, so your comments and questions are really quite welcome. At the end of the presentations, Dr. Michelle, that is the moderator of the session, will open a time interval of around 10 or 15 minutes for questions, and a round of discussions is expected to be held with the participation of the audience. So please use the chat box for that. Before going through the outstanding topics and presentations of today's session, it's my mission and honor to say some brief words about the International Society for Telemedicine and e-Health. This is mainly directed to the audience that is not yet familiar to the ISFTH. So, our society is an NGO, a non-for-profit organization in official relations to the World Health Organization. That was founded in 1997, exactly 22 years ago in Kobe, Japan. The headquarters of the ISFTH is located in Basel, Switzerland. And the mission of our society is mainly to facilitate the international dissemination of knowledge and experience in telemedicine and e-health, and to provide access to recognized experts in the field worldwide. Currently, the International Society for Telemedicine and e-health has affiliated members in all continents from over 100 countries, distributed in different membership categories, as you can see here in this slide. The society counts on the support of several working groups, like those presented here in this slide. The working groups are, in fact, a very important segment of the ISFTEH, composed by colleagues that are responsible for organizing practical activities throughout the year. And webinars like this one represent part of these initiatives. The ISFTH also organizes and supports a series of international conferences every year that usually rotate around the world. In this year, in March 2019, the conference was held in Lisbon, Portugal, organized in conjunction with the Portugal e-Health Summit and counted on the participation of over 20,000 attendees. In 2020, sorry, the next slide. Yes, in 2020, the ISFTH International Conference will take place in Takasaki, Japan, in early October, from the 8th to 10th of October 2020. So since now, all of you are invited to attend this outstanding conference that will be organized by the ISFTH in conjunction with the Japanese Telemedicine and Telecare Association. So be prepared for this very important international meeting. Also, the ISFTH organizes a series of webinars annually. So this is a very successful initiative that started, in fact, several years ago with students and nurses, as we can see demonstrated in this slide. And these sessions have the same standard of today's webinar, covering several topics of telemedicine, e-health, and digital health. Other important activities that are organized by the SFTH towards its affiliated members include the newsletter through its quarterly edition and the journal of the ISFTH. So the journal is coordinated. Sorry, the next, please. Yeah, the journal the editorial board of the journal is composed by Professor Maurice Mars, Professor Richard Scott, and Dr. Malina Jordanova. So affiliated members are invited to read and to publish their experience in the field through both initiatives, the newsletter and the journal. To those that are really interested in joining the ISFTH, next slide, please. They can affiliate via different membership categories, as you can see here. You are all welcome. So just to point out that nurse and students are special membership categories. Students up to MSc degree and nurse are free of charge membership categories. You just need to visit the ISFTH website and go directly to the how to join area. Really, I should say that requesting affiliation is a quite easy and simple process. And finally, the last slide, but not the least, this is the address of the ISFTH website. And the ISFTH looks forward to welcoming all of you as new affiliated members. Thank you very much for your attention and have a nice session. Now, I'm very pleased to invite and to grant moderator privilege through this platform to Dr. Michelle Griffith. Then she will coordinate the webinar. Welcome, Dr. Michelle, please. I'm right now preparing the next content of slides, so you can start the session. Thank you so much.
Great, thank you so much. I will be introducing our speaker of the day, Dr. Dina Ziadlou. Dr. Dina Ziadlou is an expert in healthcare digital transformation. She has over 15 years of experience in this field. During that time, she has served as an international consultant, director of HIT and telehealth, instructor and senior inspector of hospital accreditation. She is currently vice chair of the Medical and Bioinformatics Working Group of the ISFTEH. She was recently nominated to be a part of the World Health Organization Digital Health Technical Advisory Board and roster of experts in Geneva, Switzerland. So I will give the mic to Dr. Ziadlou, and if you will, as the presentation is ongoing, feel free to enter your questions in the chat box. And at the end of the presentation, we will address and hopefully have an interactive discussion surrounding the questions. Dr. Ziadlou?
Yes. Hello, dear audience. Thank you so much, Michelle, for introduction. Thank you, Dr. Adolfo, for arranging this meeting. So today I want to talk about digital transformation leadership from the perspective of the organizational change. The reason that I have selected this part of transformation in healthcare is the importance of considering the part of transformation in healthcare and the impact of the macro level factors such as human related factors, their mindset about change, their behavior to adopt digital services, and their partnership that is result in large scale changes in our healthcare organizations. Today, I will talk about the approaches that the healthcare leaders need to adopt to generate the changes, enhance the creativity and innovation, and also the approach that they need to adopt to embrace organizational change and create excellence outcomes for the healthcare system. Let's see, what is the digital transformation? Digital transformation, or DT, is the integration of digital technologies into all areas of our organizations, from the infrastructure, technologies, and processes to people, culture, the way of their learning, their communication, and performance. And while the transformation of healthcare is a result of a shared vision of healthcare stakeholders, a successful digital transformation can be the outcome of a well-developed vision, which is derived from how to nurture the agent of change, the agent of transformation, which is one of the most part of this webinar. If we review the market growth of the digital transformation, the monitoring this trend reveals that the dramatical growth of digital technologies in healthcare in a global scale. For instance, based on the Dow Jones Institutional News report in 2016, 77% of executive leaders put digital transformation in top of their organization's priorities. Another report by BDO company in 2019 indicated that 63% of the organization have already developed digital transformation strategies. 31% of organizations are developing their strategies toward digital transformation, and 74% of organizations have already established these digital technologies, and they are using and experiencing the profitability and revenue of the digital services. In a hospital size, for instance, we have an artificial intelligence market, and this market was evaluated around $90 billion in 2016, and it is expected to reach $50.23 billion by 2023. Or for instance, another technologies that we have, Internet of Thinking in the hospitals. This market exceeds $136 billion, and it will reach out to $2.1 trillion by 2021. This trend is showing that the healthcare organizations is encountering with the huge waves of technologies, and the healthcare leaders must align their strategies with digitalization. They must prepare themselves with this wave of technologies in their healthcare organizations to stay competitive and to manage all these changes in their organizations. Here I have created a table as an example of the technologies that we have in hospitals, in healthcare organizations. As you can consider in this table, there are different type of digital transformation in the healthcare. For instance, artificial intelligence. We have artificial intelligence in clinical decision systems. We have the artificial intelligence in virtual nursing, treatment design, medication management. In many hospitals have electronic health services such as EHR, electronic health records, management information system. Many hospitals are integrating their e-pharmacy, radiologist information system, laboratory information systems to have integrated and seamless patients' informations in their system. There are many different type of mobile health applications which is using for the interaction between physicians and patients. We have a cloud computing in three types: software as a service, platform as a service, and infrastructure as a service. For instance, such as Google applications and Dropbox. In the other side, we have Internet of Things. The healthcare is using the Internet of Things to applications such as personal emergency response systems, tracking and monitoring system. They use this Internet of Things to active tracker for cancer treatment. Also, thanks to robotics, we have these technologies for surgical assistance. We have nanorobots, disability assistants, and furthermore, in wearable sensors, you can have many different types of wearable sensors. For instance, the iWatches, the vital sign monitoring. We use these wearable sensors in sport medicine, and also in a telehealth, which is my forte. We have many different types of telehealth that we can deliver the healthcare services via the distance to the patients in different areas without limitation in geographical limitations or time zone limitation. The types of telehealth are telemonitoring, telesurgery, telepsychiatry, teledermatology. We have a video conferencing. There are many different types of telemedicine and telehealth services. Also, in a hospital, another example of digital transformation that you can see is a radio frequency identification system. For instance, the system such as RTLS, real-time location system to track the patients, nurses, physicians, which is great for evaluating the performance of the employees. We have this RTLS system for tracking the medical devices and surgical tools. Another application that we have is the geographical information system, which is used for population health application, mental health services, and environmental health services. And all these information, all these applications can send their data to the big data system for, and all this information can accumulate this into the big data to create an actionable strategies for the healthcare leaders. And we can use all this information for our population health and for preventive medicine. As you can see, these are the huge waves of the digital transformation that we have, and it can have a favorable and unfavorable consequences. In a favorable side, the technology, the digital transformation is great. Why? Because we can obtain the iron triangle of healthcare, which are quality, access, and cost. We can promote access of patients to the healthcare services via, for instance, telehealth. We can manage the chronic diseases. We can improve the patient's provider relationship. We can reduce duplications, reduce malpractice and medical errors. We can create link between other applications and have a seamless patient's health information. They are really good. This is a great consequence of the digital transformation in healthcare. But in the other side, we have some unfavorable consequence that we need to consider this problem to create a smooth, reliable, and accountable transition from paper system to the paperless system. For instance, based on the doctors company in 2018, this company conducted a survey among 3,400 physicians in 15 states of the United States. And the result of this survey revealed that 54% of physicians stated the advanced technologies such as EHR have a negative effect in their performance, and they experience the burnout during using the EHR system. Another survey by HIMSS in 2018 indicated that 88% of physicians and nurses have a problem with the digital technologies because of the interruption that they experience for using the, for instance, EHR system. For instance, nurses stated that they spend 21% of their 12 hours work shift with EHR and 33% with other technologies. And these technologies interrupt them 6 to 10 times per hour, which is a huge time, especially when we are evaluating the KPI of the employees. These statistics are really important. Another part of this report showed that 82% burnout for physicians. So it means that if we want to use the technologies, the digital technology can be favorable so long as it creates effectiveness and productivity. Otherwise, it can be a complex, interruptive system that is not working properly, and it is just it creates unsatisfaction and burnout among the workforce of healthcare. So as I mentioned before, we are going to have a meaningful transformation. The meaningful transformation is about how we are shifting from paper system to electronic system. It is indicate that how we are planning for having the a value-based system rather than volume-based system. It is about the interoperability of the system and the preventive system that we have when we want to create meaningful systems. So we need to have a smooth transition from from treatment services to preventive services. Ultimately, we want to have a life care services in our healthcare system rather than illness care. For this aim, today I want to talk about hidden parts of digital transformation leadership, because this is a broad term. If I want to talk about digital health leadership, it's going to be a course in a university. But I just pick up one part of this digital health leadership for you today, which is about the organizational changes that we have and how we can handle this organizational change in our healthcare organizations, because I believe that the change must start from the individual. It doesn't matter people are working in a small hospital in a town or they are serving in a best hospital in the world. We must invest in our human capital, in a operation layers, in a individuals to create big changes and global changes. So actually today I just want to stimulate the mindset of healthcare members to think about one of the ways of creating productivity and dynamic in the fast-pacing environment. For this aim, so today I just pick up one of the aspects of digital transformation, which is organizational change. Let's see what is the difference between transformation, between traditional organizations and modern and postmodern organizations, and how the traditional organizations can transform to the modern organizations. The traditional organizations are hierarchy. They focus on structure and processes. They are working on the problems, collecting the data to solve those problems. Whereas the modern and postmodern organizations are, the strategies of this organization is based on the partnership and networking. They focus on people and human capital. It is about appreciating and valuing the best. They are working on creating new mindset and building a shared vision. Uh, these modern organizations have exchange values rather than use values. They are expanding their system to have a seamless integration. They are embracing the globalization. They are the dynamic system rather than a stable system. They have they have non-linear changes in their organizations, whereas the traditional organization just have a linear changes and small steps in a changes just in its structure and process. And there are two different questions between modern and postmodern organization and traditional organization. In a modern one, they think about how do we decide what right is. But in traditional organization, they are still working in to answering this question. Are we doing things right? Are we doing right things? These are good questions, and I'm going to talk about this question later. Uh, Here, for starting my presentation about digital transformation, I just want to clarify some terms in this regard. Why I am using transformation rather than change? Because change is a shift from one situation to another situation. Uh, in a change, the organizations are endeavoring to fix the past problems and improve the current situation. Whereas transformation is about creating desired future. It is a future-oriented action. It is about how we can continuous improvement system and how we can flourishing the innovation and productivity in our system. And many of you heard about the change management. Why I don't use the change management? Because change management, change leadership, and transformation leadership have a different approaches. For instance, change management refers to a task of refers to a set of tasks. It is about the structure and processes. For instance, we use the Six Sigma for improving the processes in our healthcare organization, which is part of managing the change. It is about overcoming resistance to change, and the change management is a task oriented. While the change leadership focus on vision, it is about organizational behavior, and it is a relationship oriented. It's focused on engagement, how we can engage the employees in the process of the change, how we can motivate them and inspire them. And it is about creating the agent of change, which is the Cutter model. But the transformation leadership, what is this one? It is a meaningful oriented system. It focuses on human capital to nurture entirely different effectiveness and meaningfulness, which is derived from a shared vision of all stakeholders. In this part, we want to empower the human capital. We want to develop effectiveness. We want to realize that how we can create the sense of ownership for our employees to embrace the changes, to accept the changes. And in this part, we want to create the agents of transformation for our healthcare system. For this part, we want to see that how we can do this kind of transformation in our healthcare organization. For pivotal components that we have for digital transformation leadership. First of all, we want to create the agent of transformation. Then we want to develop the digital culture, empower human capital, and also engage the employees in the process of the transformation. First of all, numerous studies have been conducted to elaborate on leadership styles, leadership competencies, leadership theories, and different things. I don't want to talk about these things. I just want to represent the responsibility of the leaders that they have in the organizations. For instance, a leader must create a vision, cultivate the trust and transparency, communicate the vision and mission. A leader must create the equality and respect, improve the emotional intelligence, provide learning system, increasing commitment, provide job satisfaction and job security. There are many different responsibility for the leaders. But here today, I want to add some deeper concepts, deeper skills that we need for our healthcare leaders to attain for creating the agents of transformation. Baker Hospital Review in 2019 stated that many healthcare organizations are creating Chief Innovation Officer, Chief Data Analytics Officer, and Chief Nursing Information Officer positions in their organizations. And these C-suites must be a champion of the transformation, and then they must nurture the agents of transformation. For this aim, some of the skills that they need to attain are, for instance, they have to have the ability to change the mindsets and create a shared vision. They must have ability to have a horizon scanning of healthcare. They must have some skills such as system thinking, global thinking, and innovative thinking. And in this presentation, I want to talk about this kind of skills that the healthcare leaders must to attain for having the transformation agent. First of all, let's see what is the triple aim and quadruple aims of the healthcare. And these are important because I want, after this, I want to talk about why this is important for this presentation. The triple aim is about reducing health expenditure, enhancing patient experience, and promoting population health. And the healthcare system is shifting from triple aim to quadruple aim. And the reason is that in quadruple aim, the healthcare system has realized that without joy, equity, and satisfaction may not ensure to attain the triple aim of healthcare. Therefore, they add one component to the triple A, which is improve health, improve work-life balance among the employees. The healthcare system perceive that not only does medical payment service should be value-based, but also the culture, performance, and operation of healthcare should be value-based. And for this value-based, modern and postmodern organizations believe that innovative approaches such as change mindset and create a shared vision must be injected to the healthcare system. So how we can change the mindset. For instance, If we want to change the mindset of the employees, it is not a one night action. It's going to be a process for change mindset. For instance, we have to identify the capability of the our human capital. We have to nurture positive thinking. We have to invest on human capital for mindset growth. We have to improve our dialogues, communication, disclosure. We need to create joy and equity, work-life balance among the employees. We need to value stakeholders and their opinion. And it is important to develop a strengths-based system rather than focusing on weaknesses. For instance, we have an appreciative inquiry model, so we can use this model for our change for our programs in change mindset. And also we need to stimulate mindset of people to probe positivities and possibilities. It is really important to create the sense of ownership. It is important to create the culture of collaboration and care coordination. One of the ways that we can use for mindset change that I have bring this approach here is the strategy of third loop learning skills. What is the third loop learning? We have different types of learning in our healthcare organizations or in all learning organizations. Single loop learning, double loop learning, and third loop learning. What is this learning types? In a single loop learning, it is actions, and our actions creates the result and consequence. And it is based on the rules and policies. And it is just a framework. We cannot go outside of this framework. It is like an action and reaction. That's it. But in double loop learning, and one thing, in a single loop learning, we are endeavoring to answer this question. Are we doing things right? Are we doing things right? It is just a reacting process. But in double loop learning, it is about our thinking, our assumptions. It is about how we are creating new ideas and patterns, how we are probing to answer this question. Are we doing right things? It is actually a shift in our mental model to create new ideas and reframing our thoughts and our assumptions. But in third loop learning, which is about context and learning practices, we learn how to learn. It is about how we can rethink and decide and how we can transform our mindset to answer this question: what right is? If you ask me what is the difference between leadership and management, the simplest comparison between these two is that when you ask me what is the management is about doing things right. Leadership is about doing right things, but I am talking about a deeper layer of management and leadership, which is about to answer this question: what right is? And the third loop learning can provide us this tool to have a better understanding about the events. It teach us how we can respond to the situations with the best way. It improves the relationship between the different parts of a system, and we can use this approach for improving our digital transformation in our healthcare organization. The second part that I'm talking about regarding to the leadership competencies or leadership skills that the healthcare leaders must adopt in the process of creating change of agents or agent of transformation is the horizon scanning of the future. Why this one is important? Because the digital technologies, innovation and deployment have proliferated at a rapid pace and have become increasingly sophisticated. So you can see that this picture. There are different type of technologies are entering to the healthcare system: robotics, protective and preventive medicine, wearables, mobile health, data-driven decision-making systems, personalized health, and self-tool management. And the healthcare leaders cannot wait for the wave of these technologies. They must prepare themselves and the workforce for embracing these kind of changes in our healthcare organizations. They must identify the progress of digitalization and mobilization of healthcare to seize the opportunities of growth, to seize the opportunity of uh, um, innovation and partnership with other organizations. And another thing that is important for the agent of transformation nurturement is global thinking. I believe that this part is really important for the future leaders because the future of healthcare is embracing the globalization. And the healthcare leaders must perceive that they can promote collaboration, convergence, and integration between their healthcare systems and other countries' healthcare systems. Uh, we are actually in a world with many interaction and communications. It is a global world. We cannot don't pay attention. We cannot be we have to actually care about the healthcare of other countries because we want to create the agent of transformation, and we must develop this part of skills, global thinking skills in our system, because we live in a whole system, and all part of this whole system uh, are working together. They have an interconnectivity. And for instance, the problems, the crisis such as Ebola outbreak in the United States in 2014 indicated that the health of other countries connected to our countries, the experience and lesson learned, and the demographic change, the migration, global traveling, culture diversity, all these things reveal that the health of countries are bounded together and impact one another. Therefore, it is important to attain these global thinking skills for our the digital transformation. And I do love the sustainable development goals in the United Nations, especially the number 3, which is about ensuring healthy living and promoting well-being for all at all ages. This part is really important, and the healthcare leaders must to consider these goals of the United Nations and train the individuals, the workforce, about what is the sustainable development goal, what is the SDG 3, and this concept must be started from the bottom of the organizations. And the employees must understand there is a connection between our health and other countries' health and well-being. And the technology provide these tools for us. For instance, with the telemedicine, we can promote the lives of other people in the other countries, and we can reduce their movement for seeking a better health and life in other countries. We can inject the mindset of humanitarian and collaboration among the workforce for building a better future. And this movement supposed to start from the micro level, from the individuals in the hospitals, and then it can manifest it to the micro levels in a global scale. And we have all these technologies, so we have a telemedicine services, we have a mobile health, and we can transfer all the healthcare services to other countries and promote their health and well-being. And we can educate them, because one of the things is important to using the digital technologies is the health literacy. So we can use telemedicine to improve the health literacy and health knowledge of the other countries as well. Another part of creating agent of transformation is to inject the systems thinking skills. What is the system thinking? It is about viewing a system as a whole. And indeed, it amplifies the global thinking. If you see in the left side of the presentation, the slide, you can see the iceberg model. What is the iceberg model? It is showing that people have combination of some behaviors, beliefs, and events. But we can just see 20% of the people. You can see her language or his language, gender, race, partial of her success or failure. But 80% of this part is under the water. You cannot see all things about that person. But if you attain the system thinking, this system thinking can reveal the intangible specification, assumptions, beliefs, and hidden thoughts of people and their life experience, their stories about their organizations, their experience about their organizations. And with this way, we can understand the relationship of people and their dialogues, their reaction about the response about a problem or about a change. So afterward, we can stimulate the people's mindset to explore what would happen in all layers of a system that results in the current situation or the outcome of the organization. Indeed, the system thinking engage people to contemplate the solution, learn about learning, and innovate the new ways of response, and go beyond from the regular projects, go beyond the boundaries. And system thinkers are the people who conceptualize the system toward the realization of quality of life, joy, recreation, and high impact of the decisions. Therefore, this part is really important that the healthcare leader need to learn about it. Another part which is important in our agent of transformation is to create innovative thinking skills. Why this one is important? Because innovative thinking stimulates mindsets to explore the concept and meaning rather than just the results. We want to have a digital transformation leaders who motivate and reward people for discovering and creating their desired future. We want to have a champion of the digital transformation, the people who learn from the learning, create values, and go beyond the present situation. We want to have an innovative thinking in our system, and let provide this situation for people to accept new ideas, new technologies, and embrace changes. And this innovative thinking can provide this opportunity for a healthcare leader to expand his or her strategies toward embracing organizational change, toward achieving the successful outcome. Okay, when we create our agent of transformation, simultaneously we require to cultivate the positive environment for their growth. So this positive environment comes from developing digital culture, comes from human capital empowerment strategies. And what is the digital culture? I'm not talking about the culture as a written documents, or I'm not talking about the culture as a written statement. It is about the level of flexibility of employees to adopt and adapt the transformation. Uh, What is the definition of digital culture? Digital culture refers to a culture exposed by digital technologies and shape the digital mindset, change the communication, and change the lifestyle of people. And why the digital culture is important? Because according to the Stanford Social Innovation Review, in 2019, Stanford conducted a survey among 1,600 surveys and 75 interviews with leaders in digital transformation area. And the conclusion of this study revealed that the digital culture is critical, distinct, consistency, and intentional for driving the digital transformation. Therefore, considering this part of digital transformation leadership is a significant part for the progress. Why the culture is really important? Because we have different types of people in our organizations. We have patients, providers, nurses, employees, different types of stakeholders with different values, beliefs, age, experience, knowledge and skills, behavior and emotion. And the by recognizing this culture, the culture of these different uh, people, we can plan how to manage the changes in our healthcare organization, how we can shift from paper system to paperless services. And this part is important for the healthcare to understand how they can engage the stakeholders with digital transformation, how they can discover the art of involving providers, nurses, and engineers and all staffs in decision making to implement new technologies. It is about the multicultural system. When in a modern organizations we have a multicultural and cultural services, and we need to consider the different beliefs and values of the people. We need to consider their diversity. And I believe that diversity can foster the innovation and creativity in the organization. And the digital culture can provide harmony among the group and uh, help us for progress of the transformation. How we can achieve this digital culture? So it's going to be a comprehensive plan for creating or developing the digital culture. First of all, we need to monitor the uh, expectation and behavior of the users. For instance, providers, care teams, nurses, how they are using and utilizing technologies in their work. We need to create the uh, whole system concept in their mind. We need to create the innovation system. As I mentioned here, we want to create global thinking skills. We want to create innovative thinking skills. And with this regard, it is really important to create the culture of reporting medical, operational, and technical errors. because it is part of the risk taking. The employees can have a risk taking in the organizations we are using the technologies, and it is not only about reporting the issue, it is about how they can go beyond the boundaries. And this risk taking is really important because we want to stimulate the innovative thinking in our healthcare organizations. And another part which is significant in digital culture is to cultivate the aspiration of inspiration and create the collaboration culture in our healthcare organization. Another part, we have another part here for our system in digital transformation leadership. Human capital empowerment. What is empowerment? Empowerment refers to a process of giving the power of self-determination, opportunity, knowledge development, skill development, and imagination to employees to enable them to be creative in the transformation journey. And the WHO have a nice description about the human resource empowerment. It stated that the human resource empowerment is a process through which people gain greater control over decisions and actions affecting their health, which signifies a process on both the individuals and community level. But here I use the term of human capital empowerment rather than human resource, because the resource can be used, reused, or abused. But the human capital, when we are talking about the human capital, it's about the tacit knowledge of people. It is about the knowledge and skills that they have that can be as a catalyst to improve the productivity of the organization in a fast-paced environment. How we can drive digital transformation through empowerment? The most important factor is to create the future-based organization. As I mentioned earlier, we need to have a horizon scanning plan in our healthcare organization. Why? Because it is really important to create the future-based organization. We want to have accountability and learning services in our healthcare organization to empower the employees. For this aim, the programs for creating continuous learning, feedback, and improvement is essential. And also, we need to understand how to promote the mindset growth for the employees, how we can create the partnership. Partnership is really important because I believe that the competition is it should be in outside of the organization, not in the inside of the organization. In the inside of the organization, we should have a partnership, collaboration, and team-centric services. But outside of the organization, for external activities, it's okay. So you can have a competition with other organizations. It is part of the growth. But in an internal side, we need to have a great partnership among the teams and among the individuals. And also, one of the great things that the healthcare leaders can develop for empowering the human capital is to create new career models and the careers that make bridge between the functions and the departments. And the healthcare leaders are doing all these significant steps to enhance the engagement of the workforce with digital transformation. So all this will happen if we can enhance the engagement of the employees, engagement of the patients with digital health. Why this one is important? Because there are different generations in our healthcare organizations. We have a silence, we have a baby boomers, generation X, millennials. I am part of the millennials, actually, generation Z. So all these generations have a different approaches to embrace the changes, to embrace the digital technologies. For instance, the baby boomers adopted landline phone and TV. Generation X are desktop computer and email friendly. Generation Y keen on social media and tablets. And Gen Z is the geek of a smartphone. You can see every Gen Z have a smartphone. They use the Google glasses. They have a different type of eye watches, and they use the mobile applications for monitoring their diet, their health, their weight, their nutrition, their daily activities. They count their steps, and they need less direction for technology engagement. So therefore, we need to understand our generations. For instance, Gen Z are growing up in a ubiquitous mobile communication. Gen Y are global centric, technology oriented, and team centric generation. The Gen X are the people who have a high technical skills, and they are flexible, and they have a resistance to micromanagement. The baby boomers are the one who have a who are who are this work centric and believe in a hierarchy system, and the silent ones are the team players with high commitment. We have a different types of people in our organization. It is a multi generation system, and for digital transformation we need to consider this multi generation as well. And another important things, we are talking about engagement of the people, but the other side, we need to talk about the technologies. It is not just enough to speak about engagement and engagement. We need to talk about the technologies. The technologies must be attractive and user friendly enough to bring wow factors for the user. Otherwise, meaningful use of the technologies is going to be just an statement, and it is not working. As you see, for instance, earlier I described about the burnout of the physicians. We are using the EHR system, so the technology must be user friendly and create a smooth services for a smooth workflow for the user. The system must be interoperability to access, exchange, and cooperatively usage to remove the negative resistance. It is an important statement. I always say that people do not have resistance to change. They have resistance to unknown and negative changes. So this statement is important because if we create positive changes, if we create positive and transparent changes in our healthcare system, they don't have resistance to change. They embrace the change, they accept it, and they use it, and they are satisfied, and they say, wow, what is a great technology. So it is important the approach of the healthcare leaders, how they are introducing the system, how they are involving the users, physicians, nurses, engineers with technology development. And this the technology must be in direct of improving the workflow rather than a sophisticated technology. It must involve the users for in a decision making, and it is important before jumping to implementing the technologies. The healthcare leader provide the pre-awareness training, and it can be great because it can reduce the resistance to unknown. So how we can driving the digital transformation through the engagement of the employees. I talk about the workforce side, I talk about the technology, but it is significant to realize that the engagement is a mutual approach between providers and patients. And the informed and empowered patients would collaborate with better with doctors. So empowerment of healthcare workforce must be combined with patients' empowerment. We need to understand what is their preference and expectations, and technology provide us these tools to use the surveys and data mining services to collect the preference and expectation of the patients. We have a artificial intelligence to track the behavior of the patients and user via utilizing the technologies. And also, we have a personalized medicine and self-management tools so we can engage the patients in the process of their care, and we can encourage them to involve in their treatment, in their health. And these technologies, such as mobile health and telemedicine services, provide this opportunity for the healthcare system to engage patients for their health. But here, it is really, really, really important to build trust. If we want to engage the patients, if we want to engage the physicians, nurses, and all stakeholders with the technology, we need to build a trust, because they want to make sure that this technology, these digital services, is providing the no harm service for the patients. The patients want to see that they are treating properly, their health is improving. Otherwise, they cannot trust the technologies. And one of the ways that we can improve this trust is to empowering the users of digital technologies, for instance, by developing our e-learning programs and education systems, education programs that we have. And ultimately, it is important to create no unknown word for our patients, for our technologies users, because the clear pathway for treatment and care of patients must be accountable and reliable way. And this way must be embedded in a engagement part of digital transformation. Okay, I believe that the small steps create big changes. Because of that, I present this conceptual lecture for you today from the perspective of the macro level, from the individual perspective. And I just want to introduce you how the healthcare leaders can nurture the agent of transformation in a healthcare organizations. And of course, each part of each slide can be a course, and we have a short time to explain more about it, but I will be happy to answer your questions. And we are planning in a International Society for Telemedicine and Electronic Health to create a work group in digital transformation leadership. Please keep an eye in the near future to see this group, and I would love to ask you to join us for this digital transformation leadership plan to make the difference for our present and future healthcare system. And I want to wrap up my presentation with a beautiful quote from Neil Armstrong. This is one small step for man, one giant leap for mankind. Thank you so much for listening to me today. Please feel free to contact me if you have any question, or if you have any question here, I am ready to answer your questions. Michelle?
Thank you, Dina. That was excellent. Excellent presentation, and we will open now for questions. I'm looking in the chat, and I just have one question. Please suggest some good telemedicine software company in India. Okay. I think that's probably a question that we can refer to the coordinator for questions like this in the ISFTEH. So do we have any questions that are specific for the presentation today? So okay, Dina says thank you. If we don't have any questions, we will end the webinar, but we certainly want to thank you for your attendance. And certainly if you have any questions that may arise at a later date, you can certainly go to the website of the ISFTEH, as Adolfo mentioned earlier, and pose those questions, and we will get back to you. And I will certainly take this question regarding software companies in India and forward that to a party that may be able to help you.
Michelle, it's Adolfo again. I just would like to say some brief words to thank first Dina and you for coordinating this outstanding and really comprehensive webinar. Well, definitely need to start changing our mindset, or to transforming our mindset to adapt to a new period of digital health. So I'm still part of baby booming because I'm almost 60 years old. So well, but I appreciate a lot this kind of presentation, and I'd like to invite our audience to the next webinar that's planned to October or early November, probably about telecardiology. I'm not sure, but this is something we are organizing now. And please pay attention to the ISFTH website, where the activities promoted by our society are presented and informed in advance. So thank you very much. It was a great pleasure to participate. Thank you, Dr. Dina, for your very nice presentation.
Thank you so much.
Dr. Michelle, I think we can close the session now. Okay?
Yes, I'm getting ready to do that.
Thank you so much, and goodbye.
Okay, goodbye.
Bye.